Hi, this is Lee with MySentimentExactLee. I'm here with Dr. Pope with Orlando Plastic Surgery. And through this plastic surgery, cosmetic surgery journey, I have seen a lot of questions come across the blog in my Google searches that I have found some seem silly, but they've come across so often that I thought we might want to address them.
Sure.
And Dr. Pope is a very smart man, and I'm sure he's either heard them or he can answer them.
Hopefully.
Yes, we'll see. I mean, there might be some that he's going to say, no, I don't know how to answer that. But one, a really, really big one, is people have a question about why plastic surgery is called plastic surgery and whether or not when you have work done, you're going to have plastic in your body or in your face.
Okay, yeah. Believe it or not, I get asked that more often than you'd think, but it actually, the word plastikos, it's a Greek word. And it is where the term came from. It means to shape or mold. So it's not that we're putting plastic in, although you could make an argument for breast implants, they're not plastic, but we put in implants from time to time. But we're shaping or molding the body, whether it's the nose in Lee's case or other body areas. We're reshaping or remolding the body. So that's where it comes from.
Okay. So right now in my nose I do not have plastic.
Correct.
Okay. All right. Here's another one I got.
Right.
Someone asked, well, not just someone, more than one person asked, if your body after plastic surgery gets really hot, can it melt?
No.
No. That's not
won't.
because there's no plastic.
That's right.
So that kind of all worked out.
That's right.
All right. I had liposuction. I've seen a couple people ask or say more like that if you have liposuction, your fat cells can retaliate and move to a different area and get bigger. Is that true?
No, it's not true. They don't retaliate. They don't really have minds of their own. But what they, you're losing fat. You're taking fat away with the cannula, and the fat cells that remain, if you gain weight, are going to, or if you put on weight, are going to get bigger. But if you have fewer fat cells in that area, then if you're gaining weight, you're going to, as you know, you gain weight all over, a little bit all over. So you're going to gain a little bit more weight in the area where you didn't lose any of the fat. So the contour that you get after the procedure, you're going to keep. It just might get a little bit bigger as you gain weight. For example, if a lot of women come in for saddlebags, they have like wide lateral thighs. It's a lot of women have that.
I know all about that.
You take that fat away, you change the contour of the thighs. That contour, the new contour is going to stay that way. But if you gain weight, you'll get a little bit bigger there, but you're going to gain weight in other areas too.
Okay, well, so far my arms are looking pretty good, and I'm not gaining weird weight in any areas, but it's only been a month, so
right.
I'll cross my fingers. I keep looking okay.
Very good. So far, so good.
I've had a couple of searches come in through my statistics, and this worries me because I actually had someone tell me this. I remember when I was a teenager and I was considering having a nose job. And I don't know why this is a misconception, but I've had a couple people looking for, do they have to break your nose while you're still awake?
Well, you can do rhinoplasty surgery with the patient awake and sedated or totally asleep, which was your case.
Yeah.
You have to break the nose in most rhinoplasty cases, in almost all. So if you're awake under sedation, you break the nose with the patient awake, but they're sedated and you have a lot of local anesthetic on board, so you don't really feel it.
So they wouldn't feel it. But I think what
Right.
people are asking is, do you have to feel your nose being broken?
No.
Because that sounds terrifying.
No. There's no real pain involved at all.
Okay.
Because of the local anesthetic and then a little bit of sedation on board, you usually snooze or nap through that, and you don't have pain. Otherwise, nobody would want to do it.
So your priority would be your patient's comfort.
Exactly.
Okay.
Right.
Can you think of any other questions that you get asked a lot that you think maybe would be good to add to this little interview we're doing?
Well, a lot of people ask, this is pretty simple stuff, but just want to go back to work. Everybody's jobs are different. If you do any kind of heavy lifting, you need to stay home longer than if you don't. A lot of people have desk jobs and they can go back within a week or two, about a week after this type of surgery. But the more physical your job, the longer time you have to take off. That's the most common question, I think.
Yeah. For me, I had lipo in my arms, lipo in my face, and rhinoplasty. I probably would not have been able to go back to work within a week. 7 full days.
Right.
That was me, and I will fully admit that I do not handle pain well. We decided. My husband told you that. And
right.
I was in a good amount of pain and very tired.
Okay.
It's been 4 full weeks since I've had my surgery, and only very recently, within days, has my nose and arms stopped hurting enough that I haven't taken pills in well over 2 weeks. but where it's uncomfortable. I
It's
probably
kind of
would have,
achy.
yeah, I probably would have taken a full 2 weeks off.
Okay.
But that's me. I've been on a lot of chat boards with other people who have had cosmetic surgery. Some of them went back to work in less than a week. So I guess it's just all about how much you can tolerate.
Exactly. Everybody's pain threshold is different, and you have to be comfortable enough to go back to work without taking narcotic pain medication.
Right. Within 5 days, I was done with Vicodin and taking Tylenol.
Good.
So that was...
So it wasn't terrible pain.
Right.
It was just annoying, aching.
Yeah, I wouldn't have wanted to deal with people.
Right. Okay.
I wouldn't have wanted to deal with people outside of my immediate family who I could yell at and be really snarky with.
Very good. Well, I'm glad you're better.
Yes. Thank you so much. Bye-bye.